There is a quiet magic to sharing your life with a senior dog. The once boisterous puppy who chewed your favorite shoes has softened into a gentle, wise companion. Their muzzle may be dusted with gray, their steps a bit more deliberate. But the love in their eyes has only deepened with the passing of years. They know your moods, your routines, and the sound of your heart beating. This profound connection is a gift, a treasure we hold dear. We want to do everything in our power to make their golden years as comfortable, joyful, and long as they can possibly be. It's a responsibility born not of obligation, but of a deep, unwavering love for the family member who has given us so much. However, loving them isn't always enough. We must also understand them. As our beloved dogs age, their needs change dramatically. The routines and care that suited them in their youth may no longer be appropriate, and in some cases can inadvertently cause them discomfort, or even shorten their precious time with us. It's a difficult thought to entertain, but by acknowledging it, we empower ourselves to become better guardians for them in their most vulnerable stage of life. We must learn to see the world through their aging eyes, to anticipate their needs, and to adapt our care with compassion and knowledge. One of the most frequent and heartbreaking oversights is ignoring the health of our senior dog's joints. We see them struggling to get up, hesitating before jumping on the sofa, lagging behind on walks, and we often dismiss it as an inevitable part of getting older. But this slowing down is almost always a direct result of pain from conditions like arthritis. Allowing this discomfort to go unmanaged severely diminishes their quality of life, turning simple movements into painful chores and robbing them of their joy. The fix is proactive and compassionate management. First, speak to your veterinarian about your observations. They can diagnose arthritis and recommend a multifaceted treatment plan. This may include joint supplements, glucosamine chondroitin. Similarly, dental neglect is a silent danger that can have devastating consequences. We might shy away from looking inside our dog's mouth, but foul breath is more than just unpleasant. It's a major red flag for periodontal disease. Plaque and tartar buildup can lead to inflamed gums infection, tooth decay, and excruciating pain. Finding the right balance of exercise for a senior dog is like walking a tightrope. On one side, we have over-exercise. Pushing an aging dog to keep up with the same long hikes. Pushing an aging dog to keep up with intense games of fetch. It puts excessive strain on their already sensitive joints, leading to pain, inflammation, potential injury. On the other side is under-exercise. Fearing injury, some owners stop walks altogether. This lack of movement causes muscle mass to waste away, joints to stiffen, and weight to creep up, which puts even more pressure on their frame. The fix is to adapt, not abandon their exercise routine. The goal should be gentle, consistent, and low-impact movement. Swap the long, strenuous weekend hike for several shorter, leisurely strolls throughout the day. This keeps their joints lubricated and their muscles toned without overtiring them. Soft surfaces like grass are much kinder to their joints than hard pavement. Swimming is a fantastic option. Perhaps one of the most dangerous mistakes an owner can make is reducing the frequency of veterinary visits for their senior dog. It's an easy trap to fall into. Your dog seems generally fine. You want to avoid the stress and expense of a vet visit. If it isn't broken, don't fix it. However, this mindset is incredibly risky for an aging animal. Senior dogs are masters at hiding pain and illness. By the time they show obvious symptoms of a serious condition like kidney disease, heart failure, cancer, the disease is often in an advanced stage, making treatment more difficult, less effective, and more costly. The fix is simple and non-negotiable. Increase the frequency of vet visits. Most veterinarians recommend that senior dogs, usually over 7, get a wellness check every 6 months. 1 year for a dog is equivalent to 5 to 7 human years, so a 6-month check is like a human doctor visit every 2 to 3 years. These visits are not just for vaccinations. They let your vet perform a thorough physical exam. As a dog's body ages, we tend to focus almost exclusively on their physical health, joints, diet, mobility. In doing so, we often make the mistake of overlooking their mental health. We assume that because they sleep more, they no longer crave stimulation. This couldn't be further from the truth. A bored dog is an unhappy dog. Without mental exercise, senior dogs can become apathetic, anxious, or develop cognitive dysfunction similar to dementia. Their world can shrink to their bed, their food bowl causing a decline in well-being and loss of spark. The fix is gentle, age-appropriate enrichment. You don't need complex tricks, simple, rewarding activities. Work, puzzle toys, food dispensing toys. Instead of a bowl, put kibble in a toy nudge roll paw to get food. Feeding becomes problem-solving and feels rewarding. One of the most profound challenges in caring for a senior dog is their stoic nature. Dogs are genetically programmed to hide pain. It's an instinct from the wild. That instinct persists in our pets and can cause us to miss subtle discomfort. We expect a yelp or a limp, but signs are more nuanced. Misread reluctance to play as grumpiness. Mistake increased panting for being hot. Mistake licking a joint for normal grooming. Not reading their quieter language lets them suffer. The fix: be a diligent, compassionate detective of behavior. Learn to spot cues that whisper, "I hurt." Changes in posture, hunched back. Changes in posture, low-hanging head. Shifting weight frequently when standing. Slow, careful movements when lying down or getting up. Increased panting even at rest. Behavioral change, withdrawn. Behavioral change, irritable. Behavioral change, avoids being touched or groomed. Just as we might overlook the internal world of the gut, we can also mistakenly neglect the external barrier, their skin and coat. As dogs age, their skin can become drier, less elastic. We design our homes for our own convenience and mobility, often forgetting that as our dogs age, the familiar landscape of our house can become a challenging and even dangerous obstacle course. The slippery hardwood floors they used to race across can become a source of fear and instability, increasing their risk of a painful fall. The steep staircase they once bounded up and down can become an insurmountable mountain. Even something as simple as a high-sided dog bed or a raised food bowl can present a new, difficult challenge for a stiff, arthritic body. Failing to adapt the home environment to their changing physical abilities is a mistake that can lead to injury, anxiety, and a reduced quality of life. The fix is to walk through your home and see it from your senior dog's perspective. The most immediate and impactful change you can make is to address slippery floors. Place non-slip rugs. Runners' yoga mats, especially near their food bowl, their water bowl, their bed, and on the path to the door. This provides crucial traction, giving them the confidence to move around without the fear of their legs splaying out from under them. For dogs who are still navigating stairs, apply non-slip treads to each step. For those who can no longer manage stairs, use baby gates to block off access. The years we share with our dogs are never long enough. This truth feels most poignant when their muzzles turn gray and their steps begin to slow. Looking back over these common mistakes, it's easy to feel a pang of guilt, to wonder if we could have done more sooner. But this is not a journey of regret. It is a journey of empowerment. The love you have for your senior companion is the most powerful force in their world. And by channeling that love into informed, compassionate action, you can profoundly change the quality of their remaining years. The twilight of their life does not have to be a period of decline. Deep connection, comfort, and quiet joy. Each fix we have discussed, adding a joint supplement to their breakfast, placing a rug on a slippery floor, committing to a 6-month vet checkup, is a small, manageable act. None of these changes are monumental on their own, but together they weave a comprehensive safety net of care around your beloved friend. Don't wait. The time to act is now. Pick one thing from this list today. Make that call to your veterinarian to schedule a checkup. The effort is small when measured against the immense gift of more quality time with your best friend. Save and share. Subscribe to the Pawgevity community for more 360 aging dog wellness tips and support.